say it takes a village to raise a child, but let's be honest for a second. What happens when the village feels overwhelming? What happens when the help feels more like work? Whether it's your mother-in-law questioning your breastfeeding schedule, friends dropping by unannounced when you haven't showered in 3 days, or the pressure from social media to look perfect 2 weeks after birth, setting boundaries is one of the hardest parts of becoming a new mom. If you feel guilty for saying no, or if you feel like you're performing for everyone else instead of recovering, this video is for you. Today we are going to talk about how to protect your peace, manage well-meaning family members, and why saying no is actually a medical necessity. Welcome back to Maternal and Child Health 101. We've talked about the biology of the baby blues, and we've talked about the scary, intrusive thoughts. Now, we are going to talk about the external noise, the pressure to bounce back, the pressure to host, the pressure to be the perfect mother. Let's start with the biggest lie sold to new mothers, the bounce back. You scroll through Instagram, and you see celebrities in skinny jeans 2 weeks postpartum. You see influencers baking sourdough bread with a newborn in a carrier, looking perfectly rested. And you look down at your own body, still swollen, still bleeding, still exhausted. And you think, what is wrong with me? Why am I not back to normal? I want to give you a medical reality check. You are recovering from a major medical event. Inside your uterus, where the placenta detached, there is a wound the size of a dinner plate. It takes 6 to 8 weeks just for that initial healing to happen. Your organs are shifting back into place. Your blood volume is changing. Your pelvic floor is traumatized. If you had major abdominal surgery, no one would expect you to host a dinner party. No one would expect you to be at the gym. Birth is no different. The expectation that you should be up and running immediately is dangerous. It increases the risk of postpartum depression. It increases the risk of physical complications like hemorrhage, and it delays your bonding. Rest is not laziness. It is biology. So how do we protect that rest? We have to talk about boundaries. Boundaries are not mean. Boundaries are the fence that keeps the good things in and the stressful things out. And the first place we need a fence is around visitors. A new baby is a magnet. Friends, neighbors, extended family, they all want to hold the baby. They want to smell the newborn head. They want to take a picture. But often, they come over, hold the baby while it sleeps, and you run around hosting. You make the coffee. You clean the living room. You serve the snacks. That is backwards. You need to set a visitor policy before you are drowning. Here's a script you can use. Send a text to your family group chat. We are so excited for you to meet the baby. We are taking the first 2 weeks to heal and bond privately as a new family. After that, we will be up for short visits between 2 p.m. and 4 p.m. Notice what you did there. You gave a timeline. You gave a specific window, and you framed it as bonding, which no one can argue with. Now let's talk about the advice overload. Everyone has an opinion. You're holding the baby too much? You'll spoil him. You should let him cry it out. Is your milk rich enough? Why aren't you using a pacifier? This often comes from the older generation. Grandmothers, aunts, mother-in-laws who raised kids 30 years ago. They love you and they mean well, but safety standards have changed. We know more now about SIDS, about attachment, about gut health. So how do you shut down bad advice without starting a fight? You use the pediatrician card. When someone suggests something outdated, like putting rice cereal in a bottle or using unsafe bedding, you simply say, I know that worked for you and I appreciate the help, but our pediatrician is very strict about the new safety guidelines, and I'm too anxious to go against their orders. This is a magic phrase. It makes the doctor the bad guy, and you get to be the compliant mom who is just following rules. You aren't disrespecting their experience. You are deferring to medical authority. Next, let's talk about the helper versus the guest. A guest comes to hold the baby, eat your food, and leaves you with a mess. A helper comes to hold the baby so you can shower. They bring food, they load the dishwasher. You need helpers, not guests. If someone asks, is there anything I can do? Do not say no, I'm fine. Say yes. Yes, actually. Could you pick up some groceries on your way? Yes. Could you hold the baby for 20 minutes so I can take a nap? Yes. Could you fold that basket of laundry? People want to help. They just don't know how. Give them a job. If they are truly there for you, they will do it. If they are just there for the baby snuggles, they might stop coming as often. And that is okay too. Now we have to tackle the digital boundary, social media. This is a huge source of postpartum anxiety. You might feel pressure to post the perfect photo of your new life. Or you might have family members who post photos of your baby without asking. It is okay to have a no social media rule for your child. It is your right to privacy. And for yourself, if scrolling through Instagram makes you feel inadequate because other moms seem to have it all together, unfollow them or mute them. Remember, you are seeing their highlight reel. You are not seeing their 3 a.m. breakdown. Comparison is the thief of joy, especially postpartum. Protect your mental space. Finally, I want to talk about the supermom myth. We have this idea that a good mother is one who does it all. She breastfeeds exclusively, she makes her own baby food, she keeps a clean house, she never complains, and she loves every minute of it. That mother does not exist. She is a unicorn. Real motherhood is messy. It is takeout food on the floor. It is crying in the shower. It is sometimes hating the process even though you love the child. You do not have to enjoy every minute. You just have to survive every minute. It is okay to say, I am not okay. It is okay to say, I need a break. It is okay to hand the baby to your partner and walk out the door for an hour just to feel like a human being again. That doesn't make you a bad mother. It makes you a smart one. You cannot pour from an empty cup. So, here's your homework for this week. Say no to one thing. Say no to a visitor you don't have the energy for. Say no to an event you don't want to go to. Say no to the guilt that tells you should be doing more. You are doing enough. You are keeping a human being alive. That is enough. In the next video, we are going to talk to the partners. We are going to give them a specific game plan on how to support you, how to handle the night shifts, and how to be the gatekeeper of your peace. You're going to want to watch that one together. Until then, go take a nap. You've earned it.